When we think about AI in medicine, we usually picture some sci-fi robot assisting in surgery or finding a new cure. But what if AI's biggest impact is happening right now, somewhere we're not even looking? Today, we're going to dive into an AI system that isn't just tweaking mental health care, it's building a brand new operating system for it. So let's just start with this number, 2,000 to 1. In any kind of healthcare setting, a ratio like this just seems, well, it seems completely impossible, right? But I promise you, this is not a typo. It's a sign of a massive shift. Because this is the ratio of patients to one single human support lead at a new psychiatric practice. Now just try to wrap your head around that. One person managing the entire care journey for 2,000 people. I mean, in any clinic you've ever been to, that would be pure chaos. It's simply not doable. So the big question is how? How on earth is this even possible? What kind of technology could unlock this kind of scale? Well, it turns out the answer is pretty surprising because we've been looking at the wrong problem this whole time. See, to really get the solution, we first have to understand the problem. And not the one we think it is, but the real hidden bottleneck. The thing that has been gumming up the works in mental health care for decades. Most of us, myself included, would probably guess the hardest part is diagnostics, right? Figuring out what's wrong with a patient. But that's not it. The real barrier, the thing that causes all the delays and frustration, it's clinic operations. It's all the boring administrative stuff that has to happen behind the scenes. And yeah, I'm talking about these things. The endless email chains just to schedule an appointment. The mountain of paperwork for patient intake. All the clinical notes and documentation. And oh my gosh, the absolute nightmare of insurance billing. Every single one of these steps is a pain for patients and a huge cause of burnout for the amazing people trying to care for them. Okay, so if the clinic's operations are the problem, how do you solve it? Well, you don't just try to make it a little more efficient. You build a whole new engine to run the entire thing. You build an AI operations layer. And this is what we're talking about, an AI native operations layer. The best way to think about it is like having a team of hyper-efficient AI agents, and they're working 24/7, handling every single administrative task, basically automating the entire back end of the clinic. So let's just walk through what this feels like for you as a patient. From the second you decide to sign up, an AI agent handles your intake. No more endless forms. Then it seamlessly coordinates your appointments with a provider, finding a time that works for both of you. As you go through treatment, the AI is in the background handling all the logistics. And maybe best of all, it's processing and managing all the insurance and billing stuff. It's totally frictionless for you, which means your doctor can spend their time actually focusing on, well, you. All right, so you're probably wondering what kind of tech actually makes this work. It sounds pretty complex. So let's pop the hood for a second and look at the key pieces that bring this all together. First up, the whole thing is built on what's called an event-driven backend. I love this analogy. It's kind of like a set of digital dominoes. As soon as one thing happens, let's say you book an appointment, that event automatically knocks over the next domino, triggering the next logical action, and the next, all without a single human having to do anything. Second, this system uses really advanced large language model agents. And listen, these are not your standard customer service chatbots. Not even close. These agents have memory, they have context, and they have tools, which lets them handle really complex multi-step jobs, like navigating a tricky insurance claim or coordinating with a pharmacy. And this part is absolutely crucial. The entire system is designed with a deep, deep understanding of the patient journey from start to finish. So it's not just a random collection of cool tools. It's a really smart, coordinated system that actually anticipates what you're going to need next in your care. And of course, we have to talk about security. This is your personal health information, after all. The whole platform is built from the ground up with HIPAA-compliant data pipelines. That means patient data is protected with the absolute highest standards of security and privacy, non-negotiable. So, what happens when you put all of these pieces together? What does this actually mean for the future of healthcare? Honestly, the implications are just huge. I love this quote, "Systems that ship directly into real patient care." Because this isn't some research paper or a concept for 10 years from now. No, this technology is live. It's being used right now, today, transforming how thousands of real patients get care. The new operating system for healthcare isn't coming, it's already here. So, all of this leaves us with a really fascinating, almost paradoxical question to think about. By automating all of the horrible administrative stuff that burns out our best clinicians, could AI actually make healthcare more human? By taking the robotic tasks away from people, does it free up doctors and therapists to do the one thing AI can't? To actually connect with us, to listen, and to care. That, right there, might just be the future we're heading towards.